Cleft lip and palate impacts 1 in 700 children in the U.S. July is National Cleft and Craniofacial Awareness and Prevention Month. And joining me now is Dr. Catey Garland. She is the medical director of the Cleft and Craniofacial Anomalies Clinic right here at American Family Children's Hospital. Help us understand, for those who maybe don't have a kiddo or a family member who's gone through this, what types of conditions this covers that you see in kids.
Yeah. Well, the most common condition is cleft lip and cleft palate. And what that is that's when the upper lip, sometimes the gum ridge where the teeth form and the roof of the mouth may not form normally. So that's the most common condition we treat. But kids can have, and adults can have other conditions affecting the bones of the skull or the face or the ears. And those are all things we take care of in our clinic.
I have my cousin's daughter has cleft lip and palate, so I understand from a family's perspective what that is like, and why I want to ask you this question about stigma and kind of the difficulties that families experience with the way their children look, and the children in the way that they interact with other kids, realizing that maybe they look different. How do you work with families to address that, to feel like they fit in? And what is your advice to the community about how we can better help get rid of that stigma?
Yeah. Thanks for asking that question. I think my advice to families is that we start talking about it early. I think empowering kids to understand what their difference is helps them explain it to other people. I love when kids come in and tell me about how they gave a science fair presentation or talked to their class about a surgery they had upcoming. So I think that's really a great way kids can educate their classmates and community. I think the other stigma that is really important for other community members to be aware of is most of these children don't have any other physical or intellectual disabilities. So they may have a physical difference in their appearance or how their speech sounds or even hearing, but are really just smart, wonderful, fun kids.
Important reminder there. And so we have some before and after pictures, and I'm not sure if we showed the after, so I want to make sure we do that because it really is apparent how far the treatment and the research has come. I mean, these are some amazing after photos. What in that sphere of kind of research and treatment, what's happening now? What are you most excited about?
I think, we're constantly trying to think about how we deliver care better. And so, one of the things that I'm always focusing on for any individual family is how do we give them the best care at the right time, the fewest number of treatments. And so a lot of our care is focused on how do we get those best outcomes. But I think also there's a lot of work in advocacy. How do we reach children in communities that aren't right here in Madison, who have to travel further, and advocate for them in their communities, and kind of minimize some of the disparities that do exist in care.
Yeah, we are lucky to live in this community with an amazing, I know you have a whole team of doctors and surgeons and experts there to help the kiddos in your care. So thank you for coming in and helping us talk about this just to kick off the month of July.
Thanks.